Well, from back pain to joint replacement, the field of orthopedics is ever growing. It's the topic of tonight's Healthline, and here's Kim Block joining us live to tell us more.
Well, thanks, Greg. And the field is growing simply because people are living longer and trying to stay active longer. Now, for a lot of people, the technology continues to improve, and hip and knee and joint replacement surgery is one option. But right now, we're going to focus on another aspect of orthopedics, and that is rehabilitation and a brand new facility in Central Maine.
How you feeling? Doing all right?
It's been just 2 days since Rick McFarland had neck fusion surgery, but he is already on his feet and getting ready to go home. He literally went from the operating room to this Orthopedic Rehabilitation unit at CMMC. It opened this past July, and the staff says it's a big step up.
We had a sort of off-site location that wasn't specific to the needs of orthopedic patients. They would put things together as they needed, and this has been specially set up for our orthopedic population.
There are 16 private rooms on the unit that combine state-of-the-art equipment with homey touches that help the patient both physically and mentally.
So this is our patient room. Again, a private room, comfort of home, aesthetically pleasing. We have the bedside monitor. Computerized charting right at the bedside allows us to have more direct patient care, more bedside time with the patient.
A communications board allows the patient to keep track of their care and learn their rehab routine, which can include the very basics.
Among the challenge areas are just first very simply getting in and out of bed. Maybe after you've had surgery or you've had an accident, being able to engage and take care of your normal routine. How are you going to get up? You're going to bathe, dress, toilet, and go on about your day. And then how are you going to walk about?
It takes a team effort from the physicians, nurses, physical therapists, and dietitians to the patients themselves.
Even when people think they're ready to go upstairs, sometimes they aren't. And it's a great facility.
Well, there you go. If he thinks it's a great facility, he looked at a little bit of pain, so that's a good endorsement. I also wanted to mention that Elizabeth Turcott was the nurse manager. And joining me now is Dr. Paul Kenyon. Nice to have you here.
Hello, Kim. Thank you for having me.
That rehab unit is new for a lot of reasons. One, it kind of changes the concept of care in terms of bringing in the team approach and connecting different disciplines.
It's true. We've really tried to integrate our office practice with our inpatient hospital practice. And a lot of the programs that we have developed are geared to make the transition from the office setting to the hospital setting as seamless as possible.
And also then to the home setting. We saw an example of some of the stairs there. There are also showers and bathroom facilities, so you can learn how to take care of yourself at home.
Yes, and that physical therapy unit is on the floor at the Institute. On site, the therapists work with the patients to make sure they're ready to go home. And when they go home, they'll be safe. And then they'll eventually follow up with us in the office.
And you're kind of the sports guy over there. What are the most common replacement surgeries that you're doing?
Well, I do a lot of ACL reconstructions and knee arthroscopies, shoulder arthroscopies, rotator cuff repairs. That's what I do a lot of game coverage as well. And I like to work with athletes and families in general to try to prevent injuries. We have some injury prevention programs that we coordinate through the office, some ACL prevention programs that I like to work with. So I try to not just do surgery. We try to prevent injuries as much as we can.
That's great. Well, good. Glad you're there, though, at the other end of it as well. And if you have a question about any of these joint replacement surgeries or the rehab, the recovery, any kind of pain you're having in your joints, it's 1-877-494-6308. And we'll be here throughout our newscast tonight to answer your questions. For now, back to you, Greg.
All right, thanks very much. It looks like people may need to be patient. Looks like the phones are pretty jammed up over there, too.
And welcome back to Healthline Orthopedics. The first thing we want to do is remind you of our toll-free hotline number tonight. It's 1-877-494-6308. We have experts on hand to answer your questions about all sorts of orthopedic issues. And if you get a busy signal, just hang up, call back in just a minute. You'll get through. Well, millions of Americans suffer from back pain. In fact, more than 13 million people annually visit a doctor's office for back pain, and it accounts for 15% of all sick leaves. But for some people, surgery can provide a lot of relief. The Orthopedic Institute of Central Maine has a lot of success stories, among them Albert Card, a longtime high school basketball and football referee. Card came to CMMC about a year ago when his back pain became so severe he couldn't even go shopping with his wife. His son suggested he see Dr. Mike Regan, who repaired Card's slipped discs and vertebrae, and a year later, Card says he has never felt better.
In the old days, everybody was against having back surgery. Say, oh, it doesn't come out good. You get more problems afterwards. But my quality of life has improved 100% and then some.
So As for Card's next step, well, he says he hasn't been back to Mount Washington yet, something he hopes to accomplish this summer. And boy, he is walking well, isn't he?
He's doing quite well.
And this is Dr. Michael Regan, who performed that surgery, among many others at CMMC.
Yes.
And what Al said in his interview there was that back pain in the past had maybe gotten not the best rap, and he was concerned about that. Things have changed a lot, haven't they?
They have changed dramatically over the last 20 years.
However, most people with back pain are not going to wind up needing surgery. What is the percentage of people who are?
The vast majority do not. Probably in the order of 1 or 2% of all people that suffer with back pain actually end up requiring an operation.
And one of the reasons it has improved is because the diagnostic techniques are so much better?
They're so much better. Years ago, people were operating based on x-rays, but over the last 20 years, the advent of MRI scan has really changed things. So pre-operatively, one always knows what the problem is and how to address it.
And who makes the decision? Obviously, you're involved in this, but how do you know when you are a candidate for back surgery? A lot of people have nagging back pain.
Sure. I think most patients start with their primary care provider and work through the primary care provider with various remedies, including physical therapy and anti-inflammatories. And only when the situation is prolonged would they then advance to more advanced imaging, such as MRI scan. And at that point in time, decisions will be made, usually by a surgeon.
And what are some of the options that are then available to them? We'll get to these at the end because we don't want to scare people off, but there are a lot of techniques you're saying where people are out the same day.
The vast majority of surgery I do is same-day surgery. Probably 3 out of 4 surgeries I do. Patients come in the morning, they have surgery in their home, sleeping in their own bed that night.
That's amazing. And what does that involve? What kind of technique?
Well, usually we do what's called a microdiscectomy or a microlaminotomy, and most of these surgeries are taking pressure off the nerves. The patients actually come to us usually not complaining of back pain, but in fact complaining of leg pain, where the nerves in the back are being pressed by arthritis and disc herniations, and they present actually telling the doctor that their leg is sore.
We don't have a lot of time left, and I want to show these. These are more severe cases. This one in particular is somebody who would have had
This is something that Mr. Card had, a problem with spinal stenosis, and he required reconstruction of his spine and did extremely well with that. He was only in the hospital for 2 nights and went home.
And what
this is a patient we see in Maine not infrequently, someone who's had a motor vehicle accident or a snowmobile accident where they have a severe fracture of their spine and they require spine reconstruction.
They're setting off security alarms with these
They
things?
are. The TSA is all over this, but they have their own protocols.
Excellent. Get a note from Dr. Regan and you'll be okay. Remember, we're here for a little while longer to take your calls through to 6:30, 1-877-494-6308. Greg?
All right, Kim, thank you.
All right, thank you, Doug. Back now to Healthline Orthopedics, and a reminder, our phone number tonight is 1-877-494-6308. So here's the good news. We're living longer and staying more active, but that can be hard on the joints. In 20 years, the number of hip replacement surgeries is expected to rise by 174%, and the number of knee replacement surgeries by some 600%. They are fascinating surgeries, and tonight we have a rare look inside the operating room at 2 of them with News 13's Catherine Parada.
Some days it's every time you take a step, and other days it's not as bad. But
a hospital bed is an unusual place to find Wendell Nason. The former Lost Valley ski worker would much rather be outdoors, but for the past several years his left knee has been getting in the way.
As long as you step perfectly, it's good, but you misstep and it hurts.
So Nason decided he'd had enough, choosing to have knee replacement surgery at CMMC's Orthopedic Institute. In the OR, Dr. Jeffrey Bush and his team completely removed the old knee, along with pieces of the thigh and shin bones, fitting Nason with these new parts and hopefully a better quality of life. Now, these are actually parts of the old knee that the doctors have just taken out. Believe it or not, this entire procedure is only going to take about 45 minutes. Now, Mr. Nason is hoping that when he recovers from this, he'll be able to get on with things that he's been missing out on doing, like going for long walks and hunting. And he's not the only person here today who's hoping to resume his old life.
It hurt my back, and I started having a lot of back pain, and it got to the point that I wasn't able to get out of bed much of any, so.
Sheila Harlow had been in the hospital for 3 days. She came to the emergency room when her back pain got so bad it kept her from being able to walk. The diagnosis, a bulging vertebrae, one that she decided to have surgically repaired under the skilled hands of Dr. Mike Regan.
I don't expect I'm going to get right out of bed and zoom around today, but I'm hoping that within a few days I'll be feeling more like my old self.
In the OR, Dr. Regan and his team perform a laminectomy, removing the disc that slipped out of place, as well as removing the bone spurs and arthritis pressing on the nerves in Harlow's back. It's a surgery that can take several hours, but Harlow should be able to go home just 1 day later. It's all in a day's work at the Orthopedic Institute, work Harlow hopes will get her back on her feet and doing the things that are important.
I have 3 grandchildren that live in the Bangor area, and that's always been a big thing for me to be able to go over and visit with them, and I hadn't been able to do that for quite a while now, so that's one thing that won't be tomorrow, but I am hoping for it before too long.
In Lewiston, Catherine Parada, News 13.
And joining me now live is Dr. Jeff Bush from the Orthopedic Institute of Central Maine, who performed the knee surgery that we just saw.
Right.
How's that patient doing?
He's doing fine. He spent 3 days in the hospital, just went home on Saturday, and he's doing well. He's getting home physical therapy and home health, and he's doing fine.
That's great. Now, obviously, the reason you guys are doing these surgeries is to get people active and mobile again. Most people come to you because they're at the point where they just can't do things they want to do.
They've failed all of the conservative options we have for them, anti-inflammatories and physical therapy and different types of injections, and the end of the road is often a hip or knee replacement.
And are you seeing a lot of younger patients, or are you seeing a lot of baby boomers?
We are seeing some baby boomers. It's not just the baby boomers, because as the technology's improved, we're able to offer this to younger patients as well. So when you mentioned that the number of hip and knee replacements is going to double over the next 20 years, it's the baby boomers, and it's the younger folks who in the past didn't have this as an option.
And this is an actual knee replacement?
This is a model of what we gave Mr. Nason, and we basically take out the cartilage at the knee, at the end of the femur and the top of the tibia here, and most of your knee, the ligaments and all the soft tissues, we try to leave in place, and we just reconstruct the knee by replacing the cartilage that had worn out.
It works great, and most people can get back to activities
Absolutely.
that they enjoy.
It's about quality of life, and we hope to get people doing more than what they were doing before they came in.
Wonderful, and it's all taking place at the Orthopedic Institute of Central Maine. That's where our experts are from tonight. We invite you to call. We're going to be here through 6:30. The number again is 1-877. I've got to look on the screen there, 494-6308. I want to thank you, Dr. Regan, and everybody from Central Maine Medical Center for helping us tonight, and we do invite you to keep calling. We'll be right back.